National Descriptive Study of Early Head Start Childcare Partnerships. My name is David Bleckley, and I'm a Data Project Manager at ICPSR. We are pleased to be co-presenting today's webinar along with the Office of Planning, Research and Evaluation and Mathematica. I'm going to begin today's presentation with an overview of how users can access the Early Head Start Childcare Partnerships data. I will then pass the microphone to our colleagues at Mathematica for an in-depth look at the study and its data. So as a bit of introduction, the Child and Family Data Archive is a project and archive of the Inter-University Consortium for Political and Social Research, or ICPSR, at the University of Michigan, through a contract by the Office of Planning, Research and Evaluation, OPRE, within the Administration for Children and Families, ACF, in the U.S. Department of Health and Human Services. The Early Head Start Childcare Partnerships data are distributed by the Child and Family Data Archive. The Child and Family Data Archive website is currently under development with an expected launch date of this summer, 2019. It will be located at www.childandfamilydataarchive.org, and through the website, researchers, policymakers, and other users will be able to explore data and data-related resources with a special focus on data funded by OPRE, the Office of Head Start, the Office of Child Care, and other ACF programs. While the Child and Family Data Archive site is under construction, the archive's data, including the Early Head Start Childcare Partnerships data, are being distributed and disseminated through the Child Care and Early Education Research Connections website at www.researchconnections.org. For those of you who have never been to the Research Connections website, here's a screenshot of what you can expect when you arrive there. So now to dive right into how to access the Early Head Start Childcare Partnerships data, you can look in the upper right-hand corner to our search bar and just type in EHS-CC, EHS-CC, and that's the quickest way to access these data. Once you get to the search results, the website will first take you to the data resources. These are different publications and other types of resources which have been released related to that search term. So in order to get to the data, please just click on the data tab, which I've circled in red here on this screenshot. And once you're on that, on the data tab, you'll see that the Early Head Start Childcare Partnerships data is the first search result there at the top of the list. So by clicking on that link, we will come to the study's data homepage. The study homepage provides a lot of important information all in one place, and we always encourage users to read a study's metadata to determine if the study might be appropriate to address your interests and research questions. So among the types of data or metadata that you find here is a summary, the PIs, different methodological information about the sample and sampling methods, as well as information about the universe and any geographic information that we have about the study as well. Also, the study homepage can be navigated through a series of tabs, and by clicking on the Data and Documentation tab, you can have access to any publicly available data and documentation that's associated with a study. Reading the study's documentation will provide lots of great background information about the study, its sampling, and how the data should be used in analysis. In the case of the Early Head Start Childcare Partnerships data, the data documentation narrative is a great place to start, and I've circled here on the screenshot how to access that. So under the study levels files, just click on download, and the documentation narrative PDF will then drop down from the download button. By clicking on that, you will download a zip file that has the PDF inside, and there are lots of ways to navigate through the documentation. You can use the bookmarks panel in order to navigate really quickly to sections that you might be interested in. The table of contents is really helpful, especially for longer documents. Beyond that documentation, I would also encourage you to look at the variables tab. This is a good way to see if a variable that you might be interested in studying and including in an analysis is included in the data. This is especially important for a study like the Early Head Start Child Care Partnerships data, because the data themselves are not available for download except through our restricted data access portal. And before you go through the process of applying for access to a restricted data set, it's really important to understand what the data elements would be in that data set. And so you can really search by different topics and keywords and see if the variables that you're interested in are in fact inside the restricted data set. By clicking on the More Options link, which I've got a red arrow here on the screenshot pointing at, you can filter and compare variables for an even deeper discovery. So if there are multiple variables about a certain keyword, you can see which ones are best fit for your analysis. The variable, as you can see here, the data set is a restricted access. As I mentioned before, we flagged that with this red highlighted text to let you know that there are special restrictions. And in order to access the data and begin the application system, a user just needs to click on the Access Restricted Data button here at the top of the study homepage. And in doing so, that brings up a modal box where you can read more about the data access and appropriate use of the data. You can also see that users who apply for access to data sets can read about their requirements here and the elements that need to be submitted with an application for data access. In the case of the Early Head Start Child Care Partnerships study, a user must have a terminal degree and be a PI eligible member of a research institution. The user's project must have approval or exemption from an institution's IRB, and if an interested user doesn't meet those criteria, or if questions come up along the way, please feel free to contact ICPSR's user support at icpsr-help@umich.edu, and we'll find a way to try to help you through the process. Again, our help email is icpsr-help@umich.edu, and I'll put that email address up at the end of this set of slides. One of the questions that comes up a lot is, what if I'm a grad student and I don't have a terminal degree? And the answer to that is you just simply have to have a professor or advisor who is advising you through your project and signing on as the PI, so that someone who's affiliated with the university at that level is involved in the project. So we always want to look for ways to help folks through any kind of access issues that may come up. Once a user is ready to apply and has all of these materials in place, please simply click on the Continue button to see the next step of the process. And you'll be prompted to either create an account if you don't already have an ICPSR account, or to go ahead and log in with your existing account. And we can also link our logins to a Google+, LinkedIn, Facebook, or ORCID account. After logging in, the user then gets to a welcome page where you would see any restricted user, you would see any in-process applications that you already have, and you also will be able to download the user agreement and read it carefully from the link in the middle of the page here. That user agreement is a really important element of the data access and application process. It is a legal agreement between the University of Michigan and the institution from which the investigator is a member, and so it really needs to go through a process of being read by the investigator and understood, as well as going up to someone who is a representative of the institution, so that the institution understands all of the ramifications of having access to these restricted data. So please download that before beginning your application process, so that if there are any issues or any kind of legal consultation that needs to happen at your institution, you can begin that process in parallel with filling out the application. Finally, the application process begins, and you can input all of the information about yourself, your research team, what your project is all about. You can upload your IRB approval and input all of the other information related to your application for restricted access. One of the more important parts of this is the confidential data security plan, and that is a multi-step process of what are you going to do to keep the data safe once the data are in your possession. Typically that means storage on a disconnected computer, a non-networked computer, which cannot access the internet while the data are in your possession. And again, if there are any issues that you come up with in the application process, you can please feel free to contact us. So if you're ready to access the data, please take a moment to go to www.researchconnections.org and find the Early Head Start Child Care Partnerships data. And again, if you need help at any point with data access, please email us at icpsr-help@umich.edu. And so with that, I'd like to pass the microphone over to our colleagues at Mathematica, Jamie Thomas and Michael Levere, who are going to talk a lot more in depth about what is the Early Head Start Child Care Partnership study and what types of data were collected and analyzed and accessible for you for secondary analysis in the future.
Thank you, David, and the ICPSR team. As David mentioned, I'm Jamie Thomas, and as David mentioned, now we'll turn to describing the National Descriptive Study of Early Head Start Child Care Partnerships and the data sets we use in our analyses that are now available through ICPSR. As I mentioned, my name is Jamie Thomas. I led the study design and will introduce the study before turning the presentation over to Mike Levere, who led the analyses. Also joining the webinar today on the Mathematica team is Tricia Del Grosso, the project director. We'd like to acknowledge OPRE, the funders of this work. We'd also like to acknowledge the rest of our Mathematica project team. And finally, we want to acknowledge the Early Head Start programs, childcare providers, and families who were so generous in sharing the information that made this study possible. I just wanted to reiterate that if you have any questions as we're going through these slides, please enter them in the question box on your GoToWebinar panel. We'll try to answer the questions that come up when we pause at the end of each section, and we will also have time at the end of the presentation for questions. So I'd like to start with an outline of our presentation today. First, we'll describe the study at a high level, including an overview of the study design and sample. Next, we'll describe the data sets we use in our analyses that are again now available as restricted use files through ICPSR. And finally, we'll provide some examples on how to use the data that we actually work through to help you out as you are trying to use the data yourselves. As a reminder, the purpose of this presentation is to give in-depth information about how to work with the restricted use file. If you'd like more information about the study itself and to see our full set of findings, please see our final report and executive summary, which are on the OPRE and Mathematica websites. First, a brief overview of the National Descriptive Study. So Early Head Start Child Care, or EHS-CC Partnerships, are between Early Head Start programs and child care providers. The child care providers can be child care centers or licensed family child care homes. The goals of the partnerships are to build more seamless care systems in communities to reach more infants and toddlers and to promote high quality early care and education services. Early Head Start programs and child care providers work together to meet these goals by combining funding, resources, materials, and staff, providing comprehensive services, and enhancing service quality. A note about terminology that will come up throughout the presentation. You'll hear us refer to partnership slots and non-partnership slots. Partnership slots are enrollment slots funded by EHS-CC Partnership grant funds. Non-partnership slots are enrollment slots funded by a source other than EHS-CC Partnership grant funds, such as child care subsidies. Here are the study's research questions. I won't read through them all, but we wanted to include the full set here since later we'll go through some example analyses based on specific research questions. Other topics of interest, which we cover in the report, are changes in child care partners' operations from before to after the EHS-CC Partnership grant. So now I'll turn it over to Mike, who will lead us through a detailed discussion of the study design, sample, and data files.
Thanks so much, Jamie. As a reminder, I'm going to pause after each section of the presentation to answer any questions before moving on to the next one. So please do go ahead and send in your questions, and we'll do our best to answer them. So let's get started by providing an overview of the study design and how we identified the sample. The study collected data from two sets of web-based surveys, one of Early Head Start Child Care Partnership grantees and their delegate agencies, and one of a random sample of child care providers partnered with those EHS programs. In 2015, the Administration for Children and Families awarded Early Head Start Expansion and Early Head Start Child Care Partnership grants. Of those awards, 250 grantees received funding for Early Head Start Child Care Partnerships, either alone or as part of joint funding for both EHS-CC Partnerships and Early Head Start Expansion. This study focuses on the Early Head Start Child Care Partnership grantees and excludes the expansion-only grantees. We sent surveys to all of these 250 grantees along with their delegate agencies. When we refer to a grantee, we mean an existing or new Early Head Start or Head Start organization that received an EHS-CC Partnership Grant Award in 2015. By delegate agency, we mean an organization to which a grantee has delegated part or all of its responsibility for operation of the partnership grant. As part of the grantee survey, respondents provided a list of child care providers they were partnered with. We used this list to randomly sample child care partners to follow up with in a separate web-based survey. We sampled both child care center partners and family child care partners, randomly selecting 1/5 of each type of child care partner per grantee, with a minimum of 1 of each type of child care partner per grantee. The child care partners are therefore a subset of the grantees and delegate agencies in that we only have a list of partners associated with the grantees or delegates that responded to the survey. We conducted the grantee survey from January to July of 2016. We sent surveys to 250 grantees and 55 delegates, and I'll explain on the next slide how we identified those delegates. Completion rates were 88% for the grantee itself and 73% for the delegate agencies. The respondent was typically the grantee or delegate agency director. And when used in the final report to describe the Early Head Start Child Care Partnerships from the perspective of the Early Head Start program, we primarily focus on the subsample of 220 EHS-CC grantees who completed the survey, and we leave out the delegate responses. By using non-response weights, we make the analysis representative of all 250 grantees that participated in the partnership program. And we'll describe these weights a bit later in the presentation. In order to know who to send the grantee surveys to, we identified grantees from a well-established list of Early Head Start programs receiving an Early Head Start Child Care Partnership. However, we also needed to identify delegate agencies to participate in the survey. Delegate agencies help to obtain the most complete picture possible of the national EHS Child Care Partnerships. To do this, we used two approaches. First, ACF provided contact information for 42 agencies that were known to be delegates. Additionally, the grantee survey included a question allowing them to identify agencies that they had delegated some of the work to, and grantees identified 13 such additional respondents. And though, as I just said, most analysis of the grantee survey excluded the delegate agency responses, this information was essential to ensure that we had the most comprehensive list of child care partners possible. Grantees might not know the minutiae of every child care provider, such as its contact information, when a delegate was helping to administer the partnership. Though the report primarily focuses on the grantee responses, the delegate agency responses are still included in the restricted use data file. The comprehensive list of child care partners was necessary to randomly sample child care partners for a follow-up survey. Both grantee and delegate agency directors were asked as part of the survey to list all child care center and family child care partners. Note that the grantees and delegates were only asked to list those partners that currently had at least one child enrolled in a partnership slot. The survey instrument was programmed to then randomly select 1/5 of each type of child care partner with a minimum of 1. So for example, if a grantee had partnerships with 3 child care center partners and 1 family child care partner, 1 of each type of partner was selected. If the grantee partnered with 9 family child care homes, then 2 of its partners were randomly selected. This random selection was done dynamically in the survey so that the grantee or delegate could be asked questions about each randomly sampled partner. This random sample of partners was then used to conduct a survey of child care partners that was representative of all child care partners involved in an EHS child care partnership. Because the random selection process ensured that at least 1 of each type of partner was sampled, though we sampled 1/5 of each partner type, the randomly selected partners are more than 1/5 of the total child care partners identified by the grantees. We conducted the web-based child care partner survey from February to November 2016. We sent the surveys to 470 child care partners that were randomly sampled from the grantee survey. And note that this is fewer than the total number of partners that were randomly sampled from the grantee survey. 4 of the partners who were randomly sampled were later found not to be eligible for the partner survey. In most instances, these ineligible providers were no longer in partnership with the grantee at the time of the survey. The overall completion rate for the survey was 82%. For child care centers, the primary respondent was a director or assistant director, while for family child care homes, the primary respondent was the manager or owner. Weights are used to ensure that the analysis of the child care partner respondents is representative of all child care partners participating in an EHS child care partnership. These weights reflect non-response at both the partner and grantee level, as well as a probability of being randomly sampled. And we'll again discuss these weights in a bit more detail later in the presentation. So I'll pause there to see if there are any questions first on the study design and sample.
No questions yet.
All right, thank you, Jamie. So let's move on to explain each of the 4 primary datasets available and the research topics that are covered in all of them. From the grantee and delegate survey, there are 3 datasets. All 3 are named with the GD prefix to indicate that it comes from the grantee and delegate survey. These numbers indicate the number of observations in the dataset, which is importantly different than the numbers reported on earlier slides about the sample sizes for the analyses. So the primary data set, called GD main, covers the responses that partnership grantee and delegate agency directors gave about their role in the partnership. This data set has 305 observations, 1 for each of the 250 grantees and the 55 delegate agencies. The data set includes grantees and delegates that did not complete the survey, but if a non-completer answered any of the questions, their partial answers are included in this data set. The second one, which is called GD Partner Link All, consists of the grantee and delegate agency responses to questions posed of all of its child care partners. Though the dataset includes grantee and delegate agency responses, the unit of observation is the child care partner, so that there's 1 observation for each partner. This data set includes 1,786 total observations for childcare partners. And note that the number of observations includes a few instances where the grantee listed the same partner twice. And that could be that either they were listed twice from the same respondent, or both the grantee and a delegate listed the childcare partner. Within this data set, there's a variable to help in dropping such duplicate partners. There are a total of 1,749 unique childcare partners, and those are indicated by the variable dup_partner being not equal to 1. The third data set, which is called GDRS partner link, is similar in nature, but instead it has one observation for each randomly sampled childcare partner rather than all of the childcare partners. This data set again includes grantee and delegate agency responses to questions specifically about a given randomly sampled childcare partner, so the unit of observation is the randomly sampled partner. And as we'll explain in more detail, there are identifiers in these data sets to make it easy for the user to merge information across all these data sets if you are so interested. The fourth and final data set comes from the Child Care Partner Survey. This data set, which is called Partner Main, consists of all the child care partner responses to the partner survey. Similar to the grantee survey, there's an observation for each randomly sampled partner, regardless of whether they completed the survey or how much of it they completed. As noted earlier, this data set is slightly smaller than the data set covering grantee and delegate responses about randomly sampled partners because 4 of the partners were not actually in partnership with the grantee. Now, let's give a brief overview of some of the research topics that can be answered from each of the 4 data sets. The first data set, GD Main, which covers the grantee and delegate agency responses, can be used to address topics like basic information about the agency, partnership development activities, quality improvement activities, and services for children and families. The examples included in the sub-bullets here offer some specific details, and you can also refer to the exact survey questions to see additional research questions. Additional topics include information about child care partners, partnership funding arrangements, and the respondent's background and experience. Importantly, the information about child care partners is not specific to any particular child care partner, but is instead about their partnerships more broadly. Specific information about particular partners is covered in other data sets. The second data set, which is called GD Partner Link All, covers the grantee responses about all of its child care partners. These questions can be used to learn basic information about the child care partner, such as enrollment capacity or the number of slots, and about partnership development, such as whether there was any prior collaboration with this provider. The third data set, called GDRS Partner Link, covers the grantee responses about its randomly sampled childcare partners. These questions can be used to learn about partnership development and partnership quality. We divided information about a grantee's responses about its childcare partners into 2 separate data sets, one about all its partners and one about randomly sampled partners, so it would be easier for users to merge between the childcare partner survey and grantee responses about randomly sampled partners without there being many missing observations. The fourth and final data set, called Partner Main, consists of all responses to the Child Care Partner Survey. Similar to the grantee survey, I'm not going to go into that much detail about the research topic so that you can always refer back to the recording of this webinar or the surveys itself for more information. The Child Care Partner Survey includes basic information about the agency, partnership development activities, partnership funding, quality improvement activities, services for children and families, partnership quality, and respondent background and experience. You might notice a lot of potential overlap between the topics here and the topics from the grantee surveys, and we'll discuss that in more detail later. So I'll pause here to see if there's any questions about the primary data sets.
No questions, Mike.
Great, thank you so much. So next, we'll move to explain the construction of sampling weights and how these weights can be used to ensure that any analysis conducted is representative of the full Early Head Start Child Care Partnership program. Note that analyses can be considered representative only if using weights. Because non-response may be systematic, or the people who did not respond have particular types of characteristics, we need to adjust for non-response in order to ensure representativeness of the analyses. We also need to account for the sampling design and the probability of selection. When using weights, analyses of the grantee responses apply to the full universe of 2015 Early Head Start Child Care Partnership grantees, meaning that any such analysis is representative of the average 2015 grantee. When using weights, analyses of data at the child care partner level apply to all child care partners participating in the 2015 grants. This means any such analysis is representative of those partners, but that it's not representative of the average grant itself. Each of the four main data sets include weight variables that can be used to make sure any analysis is representative. In the primary grantee data sets, there are two types of weights: the grant level non-response weights and the program level non-response weights. The grant level non-response weights essentially weight up the responding grantee answers to account for non-responders. Where a grantee has any delegates, those delegates have the same weight value as the grantee itself because both are part of the same grant. So for these purposes, analyses using these weights should exclude the delegate responses. The program level non-response weights serve a similar purpose in weighting up the responding grantee or delegate to account for non-responders. However, the key difference here is that delegates can have different weight values than the grantee because they're their own program. So these weights should be used if you're analyzing both grantee and delegate responses. Because the dataset covering grantee and delegate responses about all its partners includes both the grantee and delegate responses, this program weight is the appropriate one to use in analyses leveraging this dataset. Once moving to datasets that involve random selection of partners, the weights need to also reflect the probability of this random selection. Therefore, in the dataset covering grantee and delegate responses about its randomly selected child care partners, there's a child care partner sampling weight that builds on the program weight to also account for the probability of selection. As noted earlier, if a grantee had only one child care center partner, it would be selected with certainty, whereas if it had 5 partners, it would be selected with probability 1/5. This information is necessary to make the analysis representative. Finally, the child care partner dataset includes a child care partner sampling and non-response weight that both reflects the probability of random selection and also accounts for non-response in the child care survey. This weight builds off the child care partner sampling weight, so it also accounts for the grantee and delegate non-response as well. When I go through examples later, I'll note the correct weights to use to provide more concrete details about the use of these weights. This figure is intended to provide a bit more intuition about how the weights work. As noted earlier, analyses of the grantee responses are representative of the average 2015 grantee. So therefore, the size of the grantee doesn't matter. Each grantee is weighted equally. Analyses of the child care partner responses, though, apply to all child care partners participating in 2015 grants, so that each partner is weighted equally. But this means that the analysis of partner responses is specifically not representative of the average grant. A larger grant that has more child care partners will have more responses. So these types of grants are disproportionately represented when thinking about the average child care partner. At the end of the presentation, I'll come back to this a little bit to describe additional variables that are included in the data sets to help if preferring a different type of weighting scheme. So I will again quickly pause there to see if there are any questions about the weights.
Nope, no questions came through during that section.
All right, thank you. I guess this all must be very clear then. Let's next discuss the details of the data documentation intended to help users beyond what's discussed in this training. The data documentation differs slightly for survey questions and for constructed variables. For the survey questions, the variable name comes from the question number. There's also a variable label. The documentation includes the exact text of the survey question. In this example, the question from the Child Care Partner Survey, is prior to the partnership grant, how long did you partner with the grantee to provide services to early Head Start or Head Start children and families? And that has the label shortened to be prior to grant, length of partnership with grantee. This was a multiple choice question, so the tabulation here shows the possible values. The tabulation also reflects possible missing values. In this instance, if the child care partner was not previously partnered with the grantee, then they were not asked this question because it wasn't applicable. And this variable PD2A would take on a logical skip in that instance. Documentation for constructed variables is similar, except that the subheading reflects the variable label rather than the specific survey question text. Additionally, these constructed data will not have logical skip indicators. The example shown here on the slide looks a bit different because this variable, which shows the number of center slots from the grantee survey, is continuous, so there isn't a tabulation to show. Simple summary statistics are instead included. And many constructed variables will be fairly obvious from the label, but when it's not, there's an additional document you can access that includes narrative data documentation. So this slide gives an example of narrative data documentation, and in particular, you can see that the number of center slots is calculated using the underlying variables GC7A, GC7AA, and GC7BA. And the reason this seemingly simple concept is a bit more complicated is because grantees who do not have delegates were asked simply how many center slots they have, while grantees with delegates were asked how many center slots are administered by the grantee and how many are administered by the delegate. So therefore, the number of center slots is calculated as either GC7A, which is just the number that for those without delegates, or the sum of these two other variables that are the numbers with delegates. Let's shift now to talk about missing data. Throughout the data sets, there are three potential reasons that data can be missing. First, there can be survey non-response, which occurs when a respondent does not complete the survey. The non-response weights specifically address this type of non-response, as the main analysis cannot directly include information from respondents who did not complete the survey, but it can be weighted to adjust for them. The second type of missing value is a logical skip. This is one where the respondent was not asked the question because it didn't apply. The survey was designed so that non-applicable questions were automatically skipped over within the web-based survey. As mentioned earlier, logical skips will only appear in the raw survey variables, meaning variables that are reported exactly as they were answered on the survey. When conducting analyses, our approach was to omit logical skip values from calculations as there are no applicable values. Additionally, we chose not to count logical skips toward a relevant sample size or towards the number of missing responses because the question was not actually asked of the respondent. As mentioned earlier, an example of a logical skip would be the length of the prior relationship with the grantee for a child care partner that had no prior relationship. And because there is no prior relationship, the respondent wasn't asked this question, so there's no applicable value of length that could be included in that analysis. Data can also be missing if a respondent was asked a question but chose not to answer it. This is considered item non-response. In such cases, responses are left as blank. In our analysis, we counted such respondents toward the sample size and the number of missing responses. So we have a bit more information now on survey non-response, and that can be identified in a few ways. So first, there's an instrument status code variable that's included in the data. The values indicate whether a respondent completed and submitted the survey, which is this value of 2030, whether they opened the survey but did not submit it, which is 2039, or if they did not open the survey at all, which is a value of 2330. Respondents who opened the survey but did not submit may have answered some of the questions, in which case their partial responses are populated in the data. Based on this instrument status code, we constructed a variable to indicate whether or not this response should be considered as complete, or namely, if the responses would be included in our final analysis. On the grantee survey, we required the respondent to complete and submit the survey. This ensured that all the grantees and delegates provided that list of childcare partners that was needed to randomly sample childcare partners for the survey. None of the partial completers provided that list. On the partner survey, in addition to those that submitted the survey, we also included 12 respondents that completed a sufficient portion of the survey in the analysis. For more detail about what that constituted, you can refer to the narrative data documentation provided separately. So this slide offers an example of the data documentation when the variable is fairly self-explanatory, where we're using the years of early childhood experience. The variable label here is years of experience in early childhood education, categorical, which implies that we turned a continuous variable into a variable that has 3 discrete categories. The input variable here was PE4, which asks the number of years the respondent has been working with infants and toddlers. In this case, we're looking at the child care partner responses. As you can see from the table, the most common response, which was indicated for nearly half of those with valid data, or 37% overall, indicates the respondent has been working in early childhood education for more than 15 years. We use this underlying variable, PE4, to create the categorical by setting a value of 1 if PE4 was less than or equal to 5 years, 2 if it was between 6 and 15 years, and 3 if it was greater than 15 years. And you can see that that corresponds with these variable labels shown here on the last slide. Finally, based on this, we also created 0, 1 indicator variables for each of the 3 possible categorical responses. So I will again pause there to see if there's any questions on data documentation.
No questions on the data documentation.
All right, thanks, Jamie. So we're now going to move through some concrete examples of putting the data and the data documentation to use. And this will offer more details on the research questions, analysis, and findings included in the final report, and will hopefully offer an opportunity for you to start brainstorming potential interesting ways to use these data. And as I go through these examples, please feel free to submit questions. And Jamie, just interrupt me at the end of the example if there are any questions on any of them that come through.
Will do.
So the first example we'll go through is an answer to the question, what are the characteristics of early Head Start child care partnership programs? In particular, we want to explore how much experience the early Head Start programs had providing both early Head Start and Head Start services. In order to do this, we'll leverage the dataset GD main, which was the primary one consisting of a grantee's responses. We'll use a few input variables to create indicators for whether the grantee had experience providing both early Head Start and Head Start, early Head Start only, or no experience with either. So as you can see here, this figure, which comes from the final report, indicates that most of the partnership grantees had a great deal of experience providing early Head Start or Head Start services. 87% of grantees had experience providing Head Start or early Head Start services, whereas only 13% of grantees had no previous experience with either program. To conduct this analysis, we started with the raw survey variables GC4A and GC5A, which provided the number of years that the grantee had been an early Head Start grantee and a Head Start grantee, respectively. We then constructed 2 variables to indicate whether the grantee had any experience as an EHS or Head Start grantee, or basically was the number of years that they had been that type of grantee more than 0. Using these 2 0, 1 indicator variables, we created 4 variables for all possibilities of experience, having both early Head Start and Head Start experience, only one or the other, and having neither type of experience. So this table shows the tabulation of the raw variables, which then feeds into the figure that I showed 2 slides earlier. The counts are the number of respondents with a value of 1 for each of the variables. The way these variables are created makes them mutually exclusive. The unweighted percentages are shown in the second column, And finally, the weighted analysis used in the figure is presented in the third column. Because this analysis considers grantee responses about itself, the correct weight that you'd want to use here is the grant weight, which is grant_WGT. In this instance, the weights don't change the analysis, but note that in some instances, accounting for weighting can have a meaningful effect. The next example is an answer to the question, what levels of funding are used to support EHS-CC partnership programs and how are funds allocated? Here, we'll explore the various uses of startup funds as reported by Child Care Partners in the Child Care Partner Survey. This figure also comes from the final report and shows that the most common use of startup funds was for materials, supplies, furniture, and equipment. 41% of child care center partners and 80% of family child care partners did not receive startup funding from the EHS Child Care Partnership grantee at the beginning of the partnership grant program. To conduct this analysis, we drew on the question PF1B, which asks, have you used the startup funds received from the partnership grantee for any of the following? There were potential choices of administration and overhead, staff training and development, materials, supplies, furniture, and equipment, enhanced salaries and/or benefits for staff, and finally, other. Respondents checked all of the answers that applied, and they could also specify details if one of the uses was other. Importantly, this question was asked only to those who received startup funds at all, so there were a lot of logical skips in the underlying data. We made two key adjustments in the analysis that are important to point out here. First, based on frequent responses to the detailed other answers, we created a new category. 6% of child care center partners indicated that they used startup funds for building or playground renovation, and we felt this was sufficient to report separately. So you can see that right here. Additionally, we decided it would be most useful to report these numbers in the aggregate as the percentage of all partners that use startup funds. We therefore recoded logical skip answers, which were populated if the respondent didn't receive startup funds, to be zeros, which then indicated that the partner did not use startup funds for this purpose. This was particularly important because the percentage of family child care and child care center partners receiving any startup funds was so different. If we didn't recode the logical skips, we would report the relative percentages among the group that got any startup funds, and that would obscure the fact that about twice as many family child care partners as child care center partners did not receive any startup funds. So this slide again shows the raw tabulations for how we calculated these statistics for the use of materials, supplies, and equipment. The first column shows the number of respondents that answered they used startup funds for this purpose. The second column shows the number that answered they did not use startup funds for this purpose. As you can see, this number is very small. Among those who got startup funds, nearly all of them used the funds for materials, supplies, and equipment. The third column indicates the number without startup funds, or the people assumed to not use funds for these purposes. These are the respondents with logical skips. Because they didn't get startup funds, there was no point in asking them how they use startup funds, because we can infer that they did not use startup funds for any purpose. Therefore, to calculate the percentage using startup funds for materials, supplies, and equipment, we divided the number in the first column by the sum across all three columns. In other words, for child care center partners, that 58% shown in that fourth column is 136 divided by 136 plus 4 plus 95, which is 235. When conducting the analysis using weights, the numbers are slightly different, though the main takeaway is the same. Because this analysis considers questions from the partner survey, the correct weight to use here is partner weight. The next example is an answer to the question, how do early Head Start child care partnership programs provide comprehensive services to children and families? Here, we'll again use the Child Care Partner Survey, and we'll explore various types of service offerings to children in partnership slots and children in non-partnership slots. Partnership slots are enrollment slots funded by Early Head Start Child Care Partnership grant funds, and non-partnership slots are enrollment slots funded by a source other than these partnership grant funds, such as child care subsidies. This research question is important in understanding the extent to which the partnerships may have reached other children in the child care partner settings, not just those explicitly funded by the partnership. This table is a subset of Table 6.2 from the final report. It shows that many child care partners offered screenings and referrals to children birth to age 3 who were in non-partnership slots. A significantly larger percentage of child care partners offered developmental screenings and social service referrals to children in both partnership and non-partnership slots, compared with partners that offered these services to children in partnership slots only. Though calculation of statistical significance is important, I'm not going to go further into that type of calculation, as it's a methods question that can be answered by referring to the final report. So to conduct this analysis, we had to use 2 raw survey variables to construct the outcome variables of interest: whether services were offered to children in both partnership and non-partnership slots, and whether services were offered only to children in partnership slots. To do this, we used the questions FS5B and FS5C, which asked for a range of service types. Do you currently offer any of the following services to children enrolled in partnership slots? And do you currently offer any of the following services to other children birth to age 3 whose care is not supported through funding from the partnership grant? These services can be provided by the agency, by the grantee, or by a community partner. The list of possible service choices to select from was the same on both of these survey questions. For the purposes of this example, I'm going to focus on vision screening. So these indicator variables were designed to take on a value of 1 only if the partner offered the service to children in partnership slots. So if you look more closely at this previous slide, you'll see that the sum of the second and third columns always adds up to the first column, with the exception of imprecisions due to rounding, like this 42 plus 36 is 78, and so on. So therefore, a partner was considered to have offered vision screening to both children in partnership and non-partnership slots if they answered yes to both FS5B11 and FS5C11, and a partner offered vision screening to children in partnership slots only if they answered yes to the question indicating that they offered 2 partnership slots and no to the one indicating that they did not offer to non-partnership slots. These underlying survey questions are also used to create a variety of other variables that appear in the dataset and that are hopefully useful to researchers. First, for each type of service, we created an indicator for whether the service is offered to any children currently. In the context of the vision screening variables, this would take on a value of 1 if the partner offers vision screenings to either children in partnership slots or children in non-partnership slots. Second, we created a variable for the change in offering from before the partnership to after the partnership award. So the question FS5A asked whether the service was offered to children before the partnership award. The change in offering of vision screenings is calculated as whether the partner offers vision screenings following the award of the partnership grant, minus whether the partner offered vision screenings before the partnership. Because this is simply subtracting one 0, 1 variable from another, it takes on possible values of 1, 0, or minus 1. A value of 1 would indicate the partner offered vision screenings after the partnership award but did not do so before. A value of 0 would indicate the partner's offering of vision screenings hasn't changed, meaning either they don't offer now and they didn't offer before, or they do offer now and did offer before. And a value of minus 1 would indicate the partner offered vision screenings before, but no longer does after the award of the partnership grant. Therefore, we created a third type of variable that indicated newly offering the service to children. This variable becomes more useful in the analysis as it simply indicates whether the partner newly offered the service after the award of the partnership grant. Takes on a value of 1 for those where the change variable also is equal to 1, and it equals 0 if the change variable was either 0 or minus 1. As one final example, we'll discuss the types of activities early Head Start Child Care Partnership programs engaged in to improve the quality of child development services. In particular, we'll look at responses to questions about types of partnership development as reported by both grantees and by child care partners. So as I noted a while earlier, topics across both surveys are quite similar, and in some cases the questions are identical. For example, grantees were asked, has your organization provided the following professional development opportunities to child care partner staff? Whereas partners were asked the same question, except with the framing of, did the grantee provide professional development opportunities? This naturally suggests comparing responses across partner types. For example, 83% of grantees said they offered one-on-one trainings, whereas only 58% of partners said the grantee provided one-on-one trainings. However, it's extremely important that this apparent difference in the percentages of respondents answering about a particular kind of professional development opportunity does not necessarily indicate any inconsistency. Note that the framing of the question is asked somewhat differently to grantees and to partners. The grantee was asked, did you provide the professional development opportunity, which means that they have to consider their practices with all of their partners, whereas the partner was only asked about its own experience. Therefore, note that a grantee need not offer a particular professional development opportunity to all of its partners to truthfully answer that it provided the opportunity. So as an example, suppose every grantee offered coaching to half of its partners. Then every grantee would say that they offered coaching. But when asking partners if they received coaching, only half would answer yes, because only half actually were in fact offered coaching. So let me pause again there. That was a lot of examples, and let me see if there have been any questions come in that we can address.
Yes, we did have a question. If you could go back to the table where you had Child Care Center and Family Child Care Partner responses separately. Yeah.
This one, right?
Exactly. And the question was, if we were to look at Child Care Center partners or Family Child Care Partners separately, would we use the Child Care Partner weight?
Yes, so that partner weight still applies because you'd use the partner weight when you're looking at these separate analyses, because then it's representative of all child care center partners participating in the program or representative of all family child care partners participating in the program. But basically those weights will correctly account for the fact that you're really looking at analysis only within one type of partner. Well, the short answer is yes, you can use the partner weight.
Great, thank you.
All right. Okay, so we'll now move to merging grantee and child care partner survey responses. So we'll walk through two example types of research questions for which merging surveys would be particularly useful. The first research question is whether child care partner and grantee responses are broadly consistent. As we just discussed, responses in many cases can be different without automatically indicating any type of inconsistency because of the way that a grantee was typically asked a question about its practices generally with all partners, whereas the partner was asked about the one specific relationship. However, there are a few questions that are asked of the grantee about particular child care partners, in which case those responses can be compared across the grantee and partner responses. The example we'll walk through is some questions about mutual respect between the grantee and partner that are asked of the grantee about the randomly selected partner. Therefore, recall that these types of questions won't be in that main data set, but will be in separate data sets that have observations at the partner level, including the grantee responses about its randomly selected partners. The second research question would be to explore partner responses by particular characteristics of the grantee. We could use a grantee's answers to do a type of subgroup analysis of child care partner responses, and then see whether there are patterns in partner responses by the characteristics of the grantee. So this slide offers a summary of the key identifiers in each of the data sets that are helpful for merging. The grantee and delegate agency responses includes a unique identifier for each grantee or delegate, as well as the grant number. The grantee and delegate agency responses about all of its partners includes the unique ID for the grantee or delegate, as well as a unique ID for the partner if the partner was randomly selected. This is useful in merging both to the grantee responses about the randomly sampled partners, as well as to the Child Care Partner Survey responses itself. And this unique ID is going to be missing if the partner was not randomly selected. And the reason for that is there's no other information or data set that those non-randomly sampled partners can be merged to. The grantee and delegate agency responses about its randomly sampled partners and the Child Care Partner responses both will also include that same identifier for the grantee and the partner, which makes merging between these data sets quite simple. So let's now walk through an example of comparing grantee and Child Care Partner responses. The question PC4 in the grantee survey, or PQ1 in the partner survey, asks the grantee and partner to respond to several statements of mutual respect as an indicator of partnership quality. For example, one statement was individuals in the partnership demonstrate mutual respect for each other, to which the respondent could answer whether they disagreed, were neutral about that statement, somewhat agreed, or agreed. In the grantee survey, this was asked separately for each of its randomly sampled partners. To merge and compare the responses to see whether the grantee and partner each had similar perceptions of each other, you could do a simple one-to-one merge between the Child Care Partner data set and the grantee responses about the randomly sampled child care partners using those unique grantee and partner identification variables. Taking these examples, you could then explore whether grantees perceive the partnership as more mutually respectful, partners perceive the partnership as more mutually respectful, or if the perceptions were roughly similar. Another option is to look at the child care partner answers by particular grantee characteristics. So for example, we might be interested in knowing a bit more about if funding differs by the grantee's auspice. We might want to know in particular whether funding amounts vary for child care partners of community-based organizations and for partners of community action agencies. To do this, we could look at child care partner responses to the question PF3, which asks about the amount of funding per child in a partnership slot that was received each year from the grantee. Using this grantee identifier, we could do a one-to-many merge to add the grantee's auspice onto the child care data. In this instance, we need to do a one-to-many merge because each grantee can have multiple partners, and we need something the grantee reported that is in that primary GD main data set. Once the merge is complete, you could then take means or medians of the amount of funding separately by the grantee's auspice to explore whether there are important patterns here. And note that the data shown in this and the previous slide are for illustrative purposes only. It's made up and it doesn't come from any actual responses. So in doing this type of analysis, it can be useful to do some robustness checks to weight responses slightly differently than is standard. For example, the standard weights make the grantee responses to be representative of the average grant, but we might also want to show the sensitivity of the analysis if we made grantee responses representative of the average partner. Doing that would lower the importance of grantees that have few child care partners. Similarly, we could also scale the partner responses to be representative of the average grant rather than of the average partner to assess sensitivity in the partner analysis. This lowers the relative importance of grantees with many child care partners when analyzing that partner data. Assessing the sensitivity is a good way to see if results are broadly robust. And conveniently, weights for these types of analyses already exist and are included in these data sets. So I'm now going to discuss them in a bit of detail, but they are somewhat complex, as you can probably tell by the description that I just gave, and so you can always refer back to that narrative data documentation later for more information. So first, let's consider adjusting the child care partner responses to be representative of the average grant. The standard analysis would treat each partner equally, but this means that a large grantee, which in this example has 4 partners, would essentially contribute more meaningfully to the results because the characteristics of its partnership are counted 4 times as often as the characteristics of the small grantee's partnership, which only has 1 partner in this example. In order to gather information about the average grant from these partner data, we need to rescale the 1 partner from the small grantee to be treated equally as all 4 partners from the large grantee, so that we place an equal weight for each of the grantees. In practice, this means proportionately weighting up the partner responses so that the sum of all the partner weights equals the size of the grant weight. In the partner data set, there are variables that are called grant share weight and prog share weight that are already there to do this. And these are done separately for that grant weight and the program weight, where recall that the program weight is the one that takes on a separate value for a grantee and its delegates, whereas the grant weight is the same value for a grantee and all of its delegates. The other approach would be to adjust grantee responses to be representative of the average child care partner. The standard grantee analysis would treat each grantee equally, but this means that a small grantee, which in this example has only 1 partner, would essentially contribute as much to the results as the larger grantee that has 4 partners. Because we might be interested in what the average partner looks like in terms of certain grantee characteristics, it can be useful to rescale to make that small grantee count less. In this case, we scale down the small grantee to be 1/4 of the size because it has 1/4 as many partners. We therefore again made variables to help with this, which are described in that narrative data documentation. More concretely, what this does is it proportionally weights down the grantee responses so that the grant weight is equal to the sum of all of its partner weights. And there's 2 separate versions of this weight in the primary grantee data set. One is going to be for its own responses about its randomly sampled partners, which is the one that ends in _grantee resp. And one is for the child care partner responses itself, which is the one ending _part resp. And as discussed earlier, there's 2 separate weights here. These weights for child care partner responses account for partner non-response, whereas there's no analogous adjustment for the grantee responses about its randomly sampled partners, because those questions are asked of the grantee, so they aren't missing. And similar to the last example, there's also 2 separate versions of this, both for the grant weight and the program weight, depending on what you're interested in. So in total, there's 4 potential weights. So please do see that narrative data documentation available on the website for more information. So thank you so much for listening. This was a lot of information, so you should please feel free to refer back to this recording as needed. You can see the ICPSR website to get more information about data documentation and access, and you can apply to get restricted use access to these files through the link noted on the slide. And finally, you can visit the OPRE website to get a copy of the final report, which will show you the primary analyses we conducted using these data sets. So with that, I think we will pause and see if there are any questions that we can answer.
We did have one question, Mike, or this perhaps could be a question for David or the ICPSR team, just about confirming that the narrative data documentation that Mike mentioned during the presentation is available at the ICPSR website.
Yes, it certainly is, and that was part of the section that I suggested that potential users really take a look at before deciding if this study is going to be right for their analyses, because I think that's a really great place to start to learn more about the data and the work that you've done. I also wanted to take a minute to just really thank you folks at Mathematica and at OPRE as well. This project has been, you know, a really long-term effort, and you've put a lot of great work into this, and we've really enjoyed working together and for the past several years to try to get the data out. And we can tell, you know, how much effort has been put into the work, and we're really hopeful that the participants who are listening to this webinar will find the data useful, because it's just a really robust data set and a really unique study that can answer a lot of different questions in the field of early care and education, and we just really think that it's going to be a good asset for secondary analysis. And please do apply to access the data, and let us know if there's anything that we can do to help with the access of it.
Thanks, David. We appreciate your support and help through this process as well. Have any other questions come in that we can address?
No other questions.
Nope, and I even came up with a question that I was going to ask you, and then you answered it. So I thought it was a really comprehensive presentation, and I think it'll be useful. Again, folks can access this on our YouTube channel, and we'll be sending a link out to everyone who registered for the webinar, so that you can look at it again and refer back as you consider applying to access the data and conduct any secondary analysis in the future.
Yeah, and I just put up our email addresses here. If you do have additional questions moving forward, please don't hesitate to reach out.
Okay, I think that's last call for questions, and otherwise we will we'll stop the recording, and thank you all for joining us. Okay, great. Thank you all for joining us. This has been a really great data training, and looking forward to having a lot of applications to access this fantastic data set. Thank you all, and have a great day.